Welcome back to the channel. My name is Dan. I am the pharmacist here at MD Custom RX. In today's video, we're going to be talking about metformin, what those side effects are, and how to avoid them. I have a novel way, a brand new way to get around these side effects of metformin, and it's not what you think. I encourage you, if you know somebody that's on metformin and having side effects, please share this video with them. Or if you're on metformin, share this video with your doctor. Let's just talk about metformin and a little bit of the history here. So a lot of patients that are watching this probably already know this, but just so we're all on the same page, metformin is used for diabetes, insulin resistance. It can be used for polycystic ovarian syndrome, and there's a lot more other uses. In my video next week, I'm going to be talking about those other uses. Metformin has been shown, the evidence isn't great, but we're going to go through it. It talks about some of the anti-aging benefits that metformin can provide. It helps to lower sugar production and improves insulin sensitivity. So it allows our body to take up more glucose with less insulin, which is a good thing because too much insulin can cause inflammation. It also turns out that metformin is a superstar, as I have listed here, for healing skin and wounds. So this is very interesting. I'll be sharing a little bit of data on this towards the end of this video. I'll put the chapters below in the show notes, so if you want to skip right to that. Let's start talking about metformin and this bathroom drama as I have listed here. So why do patients taking metformin really hate this drug is the GI issues. As a pharmacist for over 20 years and counseling patients, this was really the number one complaint, was the GI causing diarrhea, just upset stomach in general. It really does not do well in the GI tract. Bloating, as it's listed here, gas, stomach pain in general. So this is why patients are like, man, I'm gonna crap my pants here, being on metformin. If I sneeze, I'm gonna have a problem. So, why am I sprinting to the bathroom? Well, if you just started metformin or you're on it, this could be why. Sometimes metformin just goes right through patients. And again, not everyone experiences this, but those of you that have been through the metformin GI trauma, let me know. Maybe there's some new things out there that I'm not aware of that you've done to remedy these issues. But again, we're going to talk about topical metformin in just a moment. But again, as it's listed here, this is one of the number one reasons why patients stop metformin. It's just the GI issue. So there's other issues here. This next slide here, why do some people stop metformin for other reasons? Well, it could be just their appetite becomes so low, so they have decreased appetite, which certainly can lead into the weakness issue. Some patients will get headaches with metformin. Metallic taste is another thing that's listed here. And then some patients actually will get a rash from taking oral metformin. And I don't want to go too far into today's video without talking about, there's two rare side effects that are very serious we want to talk about, which is lactic acidosis, which it talks about here. It is potentially fatal. This is no joke. We don't want to play around with this. Your doctor should be monitoring for this, especially if you have kidney impairment, as it says here, or severe illness. You need to let your doctor know. The other thing here is vitamin B12 deficiency. With vitamin B12 deficiency, this can lead to anemia and neuropathy over time. Let me know in the comments below. Are you a diabetic patient? Or maybe not, maybe you're just on metformin for other reasons. Is your doctor testing your vitamin B12 level? In my experience in talking with patients here at the pharmacy, I would say, and I don't have exact numbers, but I would venture to say at least half of the patients that I have spoken to that are on metformin, their doctor isn't testing their B12 level, which is very unfortunate. So again, if you're a patient out there, you're on metformin, I highly encourage you to ask your doctor to test your vitamin B12 level. Okay, next slide here. Good news is we have an alternative. So at our compounding pharmacy, and again, any compounding pharmacy in theory could do this, but we make a transdermal metformin cream. So you don't have to swallow another pill. I know there's some other videos out there that are talking about ways to circumvent side effects from metformin, using extended release metformin. Splitting up the dose can help, taking it with food, things to that nature. But if you're still having problems, this is a possible solution to talk to your doctor about, which is, again, transdermal metformin. And it goes right through the skin, fewer side effects. There's a great study that was done that looked at the penetration of the metformin cream, and it gets up to 90% absorbed. The other thing, I'm not going to get too much into dosing here, but I will briefly say, so if somebody's on 500 milligrams of metformin. Typically what is done with the cream is you only need to take 10% of that dose. So 50 milligrams typically is all you would need. And getting that same benefit as it says here with much fewer side effects. I will talk about the side effects of the cream in just a moment. So as it says here, why is this? Why is the topical metformin gentler on the system? Well, as it's obvious here, it skips the stomach, right? So we're not taking that drug and pushing it through the GI tract, and then it's got to go through the liver, as it says here, avoid stressing the liver with what's called first pass metabolism. We avoid all of that. And then you get this slow, steady absorption. So as this study, again, I'm going to reference this here, it takes about 16 to 24 hours to actually absorb this through the skin, which gives it that nice, slow, steady absorption. I really like that about using the Transdermal metformin cream that we compound here. So you're just going to get much more consistent, easier absorption with the Transdermal. Okay, the next slide here is talking about this added benefit about the wound healing issue. So let me be clear though before we go through this slide, is that we use a different base that is used for wound care that we put the metformin in. If we always ask the doctor or the prescriber that is calling in or faxing the order if it's not clear to us, what's the intention of the metformin topical? Is it for wound healing? Or is it for essentially systemic absorption? If it's for wound healing, we're going to use a different base compared to a patient that wants it for systemic absorption or a doctor that wants it for systemic absorption. So as it says here, it helps skin cells to, it says move, grow, and close the wound faster. It improves collagen, so it helps with collagen structure and repair. And then think of, I always say, metformin from a wound healing standpoint. It's a construction crew that shows up on time, it stays late, and it also has antimicrobial benefits to it as well, which is fascinating to me. So there are a few side effects with the topical metformin. It's not perfect like any drug. There's potentially going to be some side effects here that we have to address. So if you have very sensitive skin, you might be one of these patients that you're going to get some irritation. We can sometimes circumvent that or minimize that by changing application sites or changing the base. We have a few different options that we could use to help. But the trick here, though, is, again, with this study, there's a very specific base that helps with the penetration through the skin of metformin. So sometimes we can't, again, this isn't going to be perfect for everybody if you have very sensitive skin. But the real win here is no diarrhea, no GI side effects have ever been reported, at least to me and in the study that I'm looking at here. So again, you'd have to overdose, I think, in my opinion, taking too much metformin cream. So I hope you enjoyed today's video. I've said this in just about every video, but if you found value in today's video, please hit the subscribe button and turn on that notification. We are making a significant effort this year to get out at least one video per week. And it really helps with channel growth, and it really helps to motivate us to get more information out on repurposing old medication, finding new ways to help you live optimally. And in next week's video, I hope to get out those 5 added benefits of metformin for that anti-aging benefit. Thanks again. I love you. Stay well.